Teachers are heroes, right up until the moment they're not. Strike. November 3rd, 2021, the Scranton Federation of Teachers, or SFT, went on strike. What's happening? In 2017, the Scranton Federation of Teachers contract with the Scranton School District in PA expired. The teachers have been working for years without a contract as negotiations with the district have stalled and dragged on for 4 years. We've reached the end of the line and our patience with the Scranton School District. The district has refused to address our concerns about the slash and burn budget cuts that are significantly affecting the quality of education. Strikes are always the last resort. We held off for many months, hoping in vain we could agree on conditions that are good for kids and provide decency, fairness, respect, and trust for our educators. President of the SFT, Rosemary Boland, said in a release. What are their goals? Obviously, to get a contract, but more specifically, the teachers want health care, pay raises, measures to reverse the teacher turnover crisis, restore bus routes, restore preschool programs, and to address overcrowded classrooms. The Scranton School District is proposing that the teachers switch from a standard high-mark health insurance plan to a reference-based pricing model. A reference-based pricing model, or a RBP, is a cost containment strategy where a company, or in this case the school district, will pay a percentage of an established benchmark previously negotiated between the district and the doctors, hospitals, labs, or clinics. This just means that the district will look at a list of prices for services, then pick the best price and pay that much, which saves the school district a shit ton of money. But doctors, hospitals, labs, and clinics who feel like they aren't being fairly compensated for their time and services will charge the patient a balance bill for the remainder of the bill. And oftentimes, the patients don't know that they are on the hook for what the RBP healthcare doesn't pay. This effectively creates a situation where someone goes to see their PCP, primary care physician, for a standard checkup. They think they are completely covered by their health care, but a week later they receive a bill to cover what their plan didn't pay. The Scranton Federation of Teachers say that with a RBP, they would effectively not have health care. And they're right, because the RBP plan shifts the cost of health care from the school district to its workers. And the workers don't have the money. Not a single pay raise for 4 years. Most of their teachers are making less than $45,000 a year. They need more money. The proposed salary steps would finally bring all the teacher salaries above $45,000 a year, and with senior teachers, salary steps above 16 to $80,000 a year. The estimated necessary living wage in PA based on the cost of housing, transportation, and food is $68,000. Unfortunately, the pay raises are being held over the teachers' heads until they agree to cuts to health care. Katie Gilmartin, the Scranton School Board president, said, "The dollars are in there, and when an agreement is reached and those savings are identified, we'll be able to move those funds. So agree to losing your health insurance or else you won't get a pay raise that's slightly less below the needed living wage. And that's not even touching on how the teachers would be getting their pay raise. Those beautiful pay raises are coming from cuts to teachers' pay in other areas. Savings were realized by ending the practice of paying teachers extra pay for teaching an additional period during the defined workday, and ending the practice of paying teachers extra pay for covering a class due to teachers' absences during their defined workday. So it's not even a pay raise, it's more of a pay slide.
Slide to the right, slide to the left. Take it back now, y'all.
Teachers will be making the same amount of money, only now in the books it won't be attributed to covering extra periods. Thanks, I hate it. The SFT would also like to see the school district take measures to address the teacher turnover crisis. According to the Economic Policy Institute's report on the teacher turnover/retention crisis, 13.8% of teachers are leaving their school or the teaching field altogether, and schools are struggling to fill the vacancies. The Scranton School District has lost over 100 teachers in the past 2 years. Contributors to the turnover crisis are low pay, staff shortage, and less control over their classrooms. Lack of sufficient qualified teachers and the staff instability that accompanies turnover threaten students' ability to learn and reduce teachers' effectiveness, and high teacher turnover consumes economic resources that could be better deployed elsewhere. The teacher shortage makes it more difficult to build a solid reputation for teaching and to professionalize it, which further contributes to perpetuating the shortage. Not to mention that the shortage is unevenly distributed so that lower socioeconomic school districts and majority POC school districts have a harder time filling vacancies. So what can the Scranton School District do to address the shortage? Well, a good first step would be giving an actual pay raise and keeping the teachers' health insurance, but also hiring more support staff, not cutting the arts and electives, smaller classroom sizes, and allowing teachers more freedom in designing their curriculums instead of curriculums designed to prepare students for taking standardized tests. But pay raise and health insurance is a good start. The teachers want to get rid of crowded classrooms and to add more bus routes. Larger classrooms and combining bus routes are a cost containment strategy, but larger classrooms are connected to deficits in learning. Large classrooms limit the amount of time teachers have to work with individual students, so struggling students are neglected. In particular, neurodivergent students who need extra help. One way to counteract large classrooms is to hire paraprofessionals to work with neurodivergent students and give them the one-on-one care they need. Paraprofessionals are credentialed education professionals who work under the direction of a certified teacher in order to provide instructional, language, behavioral, physical, and medical support for disabled, neurodivergent, or English learning students. But the Scranton School District furloughed their paraprofessionals without health insurance in order to save money. So I guess neurodivergent students are fucked. Well, more than they generally are. And in case you forgot, we are in the middle of a pandemic. In addition to the learning deficits caused by large classrooms, it's also a health concern. Children ages 2 to 12 cannot get the COVID vaccine. Their only protections are masks and social distancing. Social distancing is very difficult in large in-person classrooms and without more buses to go on the bus routes. Like the school district is going to stuff children into poorly ventilated metal cans in order to save money. Excuse me. The teachers also want to save the preschool program. Preschool programs give children a boost. Studies show that children that attended preschool programs perform better in school. And free preschool programs allow parents to save money and go to work without worrying about their children. On the low end, for profit daycare can cost as much as $760 a month. That's a lot. This whole situation is made worse by the pandemic and the state recovery plan. The American Rescue Plan Act, feat the stimulus checks, provided $123 billion for a period of 3 years to fund K-12 education in order to make up for the learning loss due to the pandemic. During the pandemic, schools switched from in-person learning to online learning. Unfortunately, not everyone had access to the internet for online learning. 23 million Americans, or 39% of households, do not have internet. Schools have taken efforts to close the digital divide through providing Wi-Fi access and computers, but have still fallen short. Households without internet have received study packets, but have no access to their teachers except for brief phone calls. According to estimates by the DOE, students have lost at least a year of learning. As in-person learning starts again, several students are playing catch-up in a system with large classrooms and without paraprofessionals to lighten the load. What does this all have to do with the state recovery plan? Quite a lot. The Scranton School District is in debt. Let's just ignore how stupid it is to expect schools to turn a profit and how maybe we shouldn't expect social services to also behave as businesses where the emphasis is on profit and cutting expenses when the expenses that are cut are often detrimental to students, like getting rid of teachers, shop classes, home ec, mechanics, the arts, paraprofessionals, and having larger classes. Let's just set all that aside for a moment. In PA, when a school district is in debt, it is placed into a recovery state. In recovery state, they get extra funds from the state government in exchange for allowing a chief recovery officer to audit the school district and cut any extra expense. The CRO places constrictions on how the district can spend their budget, and the district has to come in line with the CRO's guidelines. And it is these guidelines that are forcing this bizarre situation. For example, the school district was required to bring all teacher salaries above $45,000 a year, but they were not allowed, per the guidelines, to raise property taxes in order to raise funds. So when Katie Gilmartin fearmongers in conservative publications about raising taxes, she is misrepresenting the facts. So they cut extra pay for teachers working extra periods and changed the health insurance to RBP in order to generate extra funds. Not enough buses for all students to be bused to school according to COVID guidelines. The CRO only allows the school district to add 7 more buses. Changing curriculum? The school district was required to remove redundant classes and programs. Larger classrooms? It's a result of cutting classes and programs. Cutting the preschool programs? Yep, CRO. So I do empathize with the school district's prickly position. In order to get the funds they desperately need, they have to play ball and abide by these ridiculous guidelines. Who cares that they're harming students, putting them in physical danger, and making it harder to ensure that individual students succeed academically? Not the state government! So fine, let's fuck over teachers and students. As long as the school district becomes profitable again, whatever the fuck that means. How do we support the workers? Share, donate, sign the petition, links below. There's a cultural myth of the teacher as a hero, but if we truly believed that, then teachers wouldn't be forced to beg and plead for health care and a living wage. It's time for us as a society to put our money where our mouth is and to stop valuing profit over children's education. Well, I was stuck in bed and you were stuck here with me. But now you may go and live your lives. Go, be cute, keep gay, be crime. Bye!
Julie, do the thing.
Don't freak out. It's not real.